I am Dr. Anil Kumar, Pediatric cardiac surgeon in KIMS hospitals here in Hyderabad. We have with us a family from Sudan, a baby and the parents and the uncle of the baby, who came all the way from Sudan to our unit here in to our pediatric cardiac surgery unit here in KIMS hospital for surgery. The baby is 7 months old. You can see the baby is very tiny in weight, and is 7 months old and was diagnosed with a major problem in the heart. The heart problem is congenital. The baby has two problems in the heart. First is severe coarctation of aorta. That means the tube which comes out from the heart, from the left side of the heart, aorta, after the origin of the neck vessels, it is tightly blocked. That is called coarctation of aorta. Now, and in addition, the baby's mitral valve is badly leaking. This is called mitral regurgitation. So the mitral regurgitation is severe. So because of both these problems, severe coarctation of aorta and mitral valve leak, the left ventricle of the baby is very much dilated. The heart is big and the left ventricle is dilated and hardly moving. It was severely dysfunctional with very low ejection fraction, almost. So the baby was diagnosed with this problem in Sudan and sent to us for surgery and referred here for surgery. We did a complete repair for the baby about 10 days ago, and the baby did very well. I would like to describe briefly, in simple terms, the surgery the baby underwent. Both the lesions in the baby's heart, that is the coarctation of aorta and the mitral valve, are difficult to deal because it's not a very common association. Coarctation of aorta with mitral valve regurgitation is not very common. Usually coarctation of aorta will be associated with a hole in the heart, VSD. But this baby did not have any hole in the heart, but on the contrary, the mitral valve was very badly leaking. That is because of the coarctation of aorta, there is a lot of back pressure in the ventricle, and the ventricle was dilated and severely hypertrophied and dilated. And somehow the mitral valve also was leaking. It was pathologically abnormal. Now, to repair of the coarctation of aorta in this 7-month-old baby is usually done, but mitral valve repair in this small baby is difficult to perform because the mitral valve has both problems in the baby. The anterior leaf of the mitral valve is prolapsing. It is free floating. It's because of the abnormal caudal attachments. The chordae of the leaf of the mitral valve are not very normal. Secondly, the mitral valve annulus, that is diameter, is dilated. So both these problems are difficult to handle for a surgeon. What we did from the midline, we did the coarctation of aorta repair on cardiopulmonary bypass, that without causing the brain flow, without circ arrest. A lot of people do operation on the coarctation of aorta with and heart lesions together with circulatory arrest, which we don't do that here. What we do, we flow the brain. We put the blood flow to the brain is preserved during the repair of coarctation of aorta by what is called a special technique called selective cerebral perfusion using innominate artery cannulation. That's what we did in this baby. After doing the coarctation of aorta repair, we addressed the mitral valve in a very aggressive approach. The mitral valve, the leaking, the anterior leaflet which was prolapsing or which was not supported, we put a artificial chordae, that means made of synthetic material called polytetrafluoroethylene, Gore-Tex chordae. It is called Gore-Tex chordae. That means it's a Gore-Tex the fine thick fine thread, which is not very fine, but it's quite strong. So that the thread is sutured to the heart muscle and the leaflet of the mitral valve, so that the leaflet will not move, will not the dance, the free floating in the ventricle, and will move normally. That's what we did in this baby. To do in such a small baby a Gore-Tex chordae replacement of the mitral valve is quite tricky and is very difficult. So it had and in addition, the diameter of the mitral valve was big, so we made the diameter smaller by doing an annuloplasty, by using baby's own material pericardium and did angioplasty for the baby mitral valve. So both together, the mitral valve repair was very satisfactory, and the baby had very good result. I mean, the coarctation of aorta was completely repaired. There's no grade. There's no the arch of the aorta is normal. In addition, the mitral valve is not leaking anymore. This got normal mitral valve. So with both these conditions, the baby will have essentially normal life, a normal growth, normal life in future. The baby was discharged from the hospital a couple of days ago, and is ready to go back to Sudan with the family the following week. The family would like to share a few thoughts about the operation and their feelings here in KIMS Hospital.
We are coming from Sudan 1 month ago. The baby was suffering from major problem in the heart, so we referred by a doctor in Sudan to make the surgery in India. So we decided to come here to KIMS Hospital, and we make the surgery 10 days ago. Now, as you know and as you see, that the baby is feeling good, and we are very happy that we are going back home, and we are very happy that for the honesty and the goodness of the people here, and the staffs of the hospital. And we are very thankful for Dr. Anil for his service, and we hope nothing will happen again in the future. And that's it. Thanks.